Can anyone see you? No, for the camera. Oh, okay.
Okay, that's 4 o'clock there, Chairman. If you're ready to make a start, I will ask you to take the reins and then start sharing the presentation if everyone's ready.
When you're ready. Good afternoon, everyone, and welcome to the CDDFT Annual Staff Awards Ceremony. This event is a wonderful opportunity to come together to celebrate the incredible dedication, compassion, and hard work demonstrated by all our colleagues. During the course of the year, I've had pleasure to visit many different wards and departments and to meet many colleagues and teams. And
Richard, you're on mute.
I think we've lost Sue and Sue's connection rather than Richard's.
Hop next door and find out what's going on.
Excellent.
okay, folks, sorry, we had a bit of a technical jump there. Just going to start again because I really want you to hear just how fantastic you are. So good afternoon, everyone, and welcome to the CDDFT Annual Staff Awards Ceremony. This event is a wonderful opportunity to come together to celebrate the incredible dedication, compassion, and hard work demonstrated by all our colleagues. During the course of this year, I've had the pleasure to visit so many different wards and departments and to meet many colleagues.
I'm sorry, Chairman, we've lost your sound again.
I'm continually amazed by the resilience and commitment each of you has shown, whether on the front line or behind the scenes. Every one of you has played an essential role in assuring we provide high quality, safe and compassionate care for all our patients. This afternoon, we take a moment to recognise those individuals and teams who have gone above and beyond their roles. We received over 200 nominations this year, and I've had the great pleasure of reading all of these wonderful stories that you've shared with us. They're a testament to the remarkable talent, innovation and kindness that defines our organisation. I'd like to take this opportunity to congratulate those of you who were nominated or shortlisted, and to thank those of you who took the time to nominate a colleague, friend, team, service or department. I'd also like to thank our charity team for their support in securing some fantastic prizes from local businesses. And to those of you who've joined us this evening as we shine a spotlight on just some of our amazing Team CDDFT colleagues. So, without further ado, I'll hand over to Noel to present our first award.
Thank you very much. 2024 is our year of quality, and through this category, we are looking for an individual or team that exemplifies this, going beyond their job description to deliver the best possible patient care. Shortlisted for this award are the orthoptic team, which is trust-wide, Carly Lloyd, community palliative care nurse, and dermatology outpatients. This award is sponsored by Queensway Dental, and the prize is 1 year of letterbox flowers from Bloom and Wild worth £240. Gracious. And the winner is, drum roll please, Carly Lloyd. I'll now read a summary of the nomination for Carly, who's a community palliative care nurse. She's shown exceptional leadership and professionalism during a crisis. While speaking to a patient's wife over the telephone, she heard a smoke alarm, and the wife discovered a fire with her husband in the same room. Carly calmly alerted the fire service and drove to the scene. Upon arrival, despite the chaos, Carly remained composed, calming the distraught wife and assisting emergency services. Her quick thinking and courage were praised by the fire brigade, the police, and ambulance crews. She went far beyond her duties, demonstrating the core values of CDDFT. Well done and congratulations, Carly. I'm going to hand over next to Lorraine Nelson, who's going to talk about the Quality in Care Non-Clinical Award. Lorraine.
Thank you, Noel, and echo your comments around being really privileged and feeling really privileged to be here celebrating the success of our teams this evening. So this award is looking for an individual or team that goes beyond their job description to help the trust deliver its objectives and values, similar to the last one, but from a non-clinical perspective, demonstrating dedication, determination, and how they contribute to the trust delivery of high quality patient experience and care. The shortlisted nominees are Kevin Park, Carolyn Mason, Louise Farrow, and the digital health team. I always think they give an award for me to present that they know I will be quite envious of, and this year's is a spa day for two, so there is for two at Hallgarth Hotel. I'm pleased to announce the winner is Carolyn Mason. Well done, Carolyn. In summary, the nomination for Carolyn included the Safe Care Live system being introduced into County Durham and Darlington Foundation Trust in February 21 to monitor live inpatient staffing levels and streamline the redeployment based on evidence. Initially, that implementation was quite a challenge, and by autumn 23, the utilisation of the system was low. To address this, Carolyn, an experienced community nurse, was appointed in November 23 to lead the project. Carolyn adapted quickly, completing training, conducting a gap analysis, and creating an implementation plan. She's trained over 300 staff, covering 85% of ward nurses in charge, and developed resources like training videos. Her efforts have led to significant improvements in compliance and system use. Carolyn's role has been extended for a further 8 months to embed the project, focusing on senior nurses recording red flag events. Her passion and flexibility have been key to the project's success, supporting staff and enhancing patient care. Well done and thank you, Carolyn. I'm now going to hand you over to David Brown.
Thank you very much, Lorraine. It's my pleasure today to announce the award in relation to improvement in innovation. Through this award category, we're looking for a person or team who's come up with a great improvement change at work, are consistently looking for or coming up with ways to make improvements or do things better, whether for the benefit of patients or colleagues. The shortlisted nominees today are Jen Bussey, Workforce Systems Advisor, Nikki Broadhurst, Widening Participation Ambassador, and the Trust-wide Practice Education Team. The award is sponsored by Ramside Hall, and the prize is a meal in the Fusion restaurant and a Twilight Spa experience. It's my pleasure to announce that the winner today is Nikki Broadhurst. Congratulations, Nikki. The nomination in summary covered that Nikki is an invaluable asset to the Trust, consistently enhancing education and training opportunities. Nikki was nominated for the award due to significant impact she had across the Trust. In response to recruitment challenges within finance, Nikki invited the team to participate in Trust-wide events to raise awareness of NHS careers, giving the team a rare chance to promote finance as a career path. Her efforts have not only boosted the profile, but also garnered attention from regional finance teams. Nikki's work spans 28 secondary schools, 12 primary schools, 11 colleges, and 8 universities, in total reaching some 9,852 students to be precise. She also collaborates with job centres in disadvantaged areas, supporting the Trust's Anchor Institution initiative. Her dedication has inspired many students, as demonstrated by positive feedback from schools such as the Acre Rig Academy. Nikki's work is making a lasting difference across the Trust and beyond. Once again, many congratulations. And with the utmost respect and dignity, I will now pass across to Jeremy Cundall.
Jeremy, you're still on mute.
Yeah, that went well. Sorry, thank you, David. Sharing Respect and Dignity award, it should be at the heart of everything we do. This award is looking for an individual, whether a manager or someone who leads by example in the way they value every person, whether patients, their families, carers or colleagues. And the shortlisted nominees are Julian Bailey from the Workforce Experience team, Claire Welsh, Macmillan team joining the dots, and Lynn Cooper, Community Nurse, Durham City East. The prize has been sponsored by Radisson Blu in Durham with dinner, bed and breakfast. And the winner is Claire Welsh. Claire's nomination reads as follows. Claire consistently goes above and beyond to ensure dignity and respect in her work, inspiring others to do the same. When a vulnerable client expressed concerns about poor hospital care and refused future treatment, Claire took action. Despite the client's reluctance to file a formal complaint, she worked with a Freedom to Speak Up guardian to address the issue and ensure future patient experiences would improve. Claire also sought additional support for a distressed client who felt their needs were being overlooked by their GP, coordinating care with a cancer nurse specialist and Macmillan palliative care team. This greatly improved the client's care and support. Claire's dedication to upholding dignity and respect is unwavering, and she encourages her team to advocate for clients who may not have a voice. Her commitment and passion making her an inspiration, and she deserves the recognition for all her hard work and leadership. Well done, Claire. And with that, I'm going to hand over to Andrew.
Thank you very much, Jeremy. And it's an honour to be here at the first of these events for me, delivering the award for kindness and compassion. Kindness and compassion leads to safer patient care and high quality patient experience. Through this award, we were looking for an individual or a team that consistently demonstrates kindness and compassion for others, whether it be a patient, relative or a colleague. And the shortlisted nominees are the Pregnancy Assessment Unit at DMH, Yolanda Appleton, Ward 4 UHND Manager, and Peterlee Urgent Care Centre. The prize is a C424M Chromebook sponsored by Resilient Business Systems. I think that's a laptop in shorthand. And the winner is Yolanda Appleton. Well done, Yolanda. So in summary, as a team, we proudly nominate our ward manager for the Kindness and Compassion Award. As Ward 4's manager, Yolanda consistently ensures high standards of care and maintains a positive work environment. Her warm, cheerful demeanour is evident as she personally greets all 40 patients each day, listening to their concerns and offering assistance. Yolanda's professionalism in handling conflicts, supporting staff with personal issues like childcare or bereavement, and encouraging career development has made her a beloved leader. She celebrates staff achievements, provides constructive guidance, and fosters lasting relationships with current and former team members. She leads by example, often assisting with clinical tasks despite her managerial role. Yolanda's open door policy, genuine care, and strong work ethic make her an outstanding leader and a deserving recipient of this award. Well done. And I'll now hand back to Noel Scanlon. Thanks, Noel. Thank you, Andrew. The next award is the Working Together for Patients Award, sponsored by CM Hall. The prize is a spa day for two, including a 60-minute top-to-toe ritual, I'm not sure that's right, per person, and lunch. It sounds fantastic, whatever it is. Delivering excellent healthcare relies on great communication, teamwork and collaboration between individuals and teams. Through this award, we look for an individual or team who's demonstrated that working together leads to delivering a service, whether to colleagues or patients, that wouldn't be possible otherwise. The shortlisted nominees are the Pharmacy Procurement Team, Ward 6 at Bishop Auckland Hospital, and Darlington Community Services Care Home Team. And the winner is the Pharmacy Procurement Team. Well done. The nomination reads that the Pharmacy Procurement Team plays a vital role in managing medicine shortages and supply disruptions, which have faced increasing challenges in the recent years. Despite these challenges, the team works tirelessly to ensure patients and clinical staff at CDDFT have access to essential medications, including painkillers, antibiotics, anaesthetic agents, and chemotherapy drugs. Their efforts prevent serious harm and inconvenience to patients, often involving coordination with suppliers and other local hospital partners to secure stock and ensure cost-effective purchases. Though their work is largely behind the scenes, they're essential to maintaining patient safety and care, and deserve recognition for their dedication and problem-solving efforts. Well done, and congratulations to the Pharmacy Procurement Team. And with that, I'd like to hand over to Sue, I think, who wants to present the Green Champion Award. Is that right, Sue?
It is, thank you, Noel. And you should find out what a ritual is at a spa, because they are amazing. So that team is going to have great fun. What a fabulous evening we're having. And it is my great privilege to share with you the nominations and present the winners for the Green Champion Award. So our green work is a key priority for the Trust. We've got a priority minimising our impact on the environment whilst providing the safest, most compassionate and joined up healthcare. So this award was looking for a team or individual working to make sure that sustainability is consistently a priority for the Trust and in the areas that they work. And we had a number of shortlisted nominees, and they are endoscopy, Pharmacy Sustainability Group, Jane Lynn, Patient Management Specialist Nurse, and Sarah Harkess, the Senior Specialist Dietitian. So well done to all of them for being shortlisted. They get the winner gets a fabulous prize sponsored by Citrus Group, and it is a Mitford pottery experience. And the winner is, this is a really interesting one because there's joint winners. We've got endoscopy and the Pharmacy Sustainability Group. So well done to both of those teams. I'm going to give a summary first of the endoscopy nomination, which reads, the endoscopy unit at DMH is part of the Green Endoscopy Network, leading efforts to increase sustainability in the NHS and reduce its carbon footprint. The unit's sustainability project is being implemented in 3 phases. Phase 1, between 2022 and 2024, has successfully reduced waste by replacing sterile gauze with paper towels, plastic cups with cardboard, and introducing reusable bottles in smart waste systems. Colleagues are also encouraged to monitor and conserve energy. Phase 2, which begins this year over into 2025, focuses on reducing the use of sterile water and transitioning from paper-based to electronic reporting systems, including QR codes for patient information. And Phase 3, which begins in 2025, will involve structural remodelling to incorporate motion sensor lighting and taps, as well as reducing the environmental impact of Entonox use by adopting water-assisted colonoscopy. These efforts reflect a commitment to making endoscopy more sustainable and minimising its greenhouse gas emissions. So big well done to the endoscopy team. Moving on to pharmacy, and a summary of the nomination for that group is as follows. Medicines contribute 25% of the NHS's carbon footprint. To address this, the Pharmacy Sustainability Group was formed in 2022, bringing together pharmacy colleagues from various areas to promote sustainable medicine use. The group's initiatives include reducing the carbon impact of inhalers by encouraging the use of lower carbon options and minimising unnecessary supply. Pharmacy assistants support medicine reuse by returning suitable items to the pharmacy, cutting waste and saving costs. Additionally, the group participates in the Pen Cycle scheme to recycle insulin devices and promotes oral over IV medication, including paracetamol and antibiotics, to reduce waste. These efforts are part of the Trust Green Plan, with further projects to come aimed at improving the sustainability of medicine across the service. So a very big well done also to pharmacy. And I'm going to pass across now to myself, interestingly, because it's the Chief Executive Team Award. So this award recognises a team, large or small, which works well to deliver a service, whether it's for patients or colleagues. We wanted to hear from wards and departments that work well as a team and were proud of the services that they were delivering. And the shortlisted nominees are Macmillan Joining the Dots, Specialist Palliative Care Team, Occupational Therapy at DMH, and Fresh and Balance. And this award is sponsored by Stevenson Mole, and the prize is a £250 voucher. These prizes are amazing. And the winner tonight is the Specialist Palliative Care Team. The Specialist Palliative Care Team provides comprehensive support for patients with terminal illnesses, both in hospitals and the community. The team collaborates with various health and social care professionals to ensure patients and families receive compassionate, high-quality care. They prioritise patient comfort, early recognition of dying, which is achieved in over 70% of patients, which is much better than the national average, and honour patients' wishes, with 90% of community patients achieving their preferred place of death. The team offers extensive training for healthcare professionals, ensuring excellent palliative care 24/7. Their service includes a 7-day face-to-face service and a consultant-led advice line for clinicians. The team's work has received high praise from patients and clinical teams alike. They also foster strong partnerships with organisations like Marie Curie and our local hospices, ensuring seamless care across different settings. Through collaboration and support, the team remains committed to both patient care and team well-being. Every year I find that this award is really difficult to judge. It's really uplifting to read all of the applications, but it's very difficult due to the quality and commitment shared within the nominations. Therefore, I would also like to reinforce how strong the evidence was for each of those teams that have been nominated, and would like special commendation to the Macmillan Joining the Dots and the Occupational Therapy team. I've also requested that an additional prize be sought to recognise the meaningful and impactful work done by Fresh and Balance, who aren't actually our employees. We host those services, but they do amazing work across the whole of the region. So on behalf of the region, we will be ensuring that they get a prize. The Fresh and Balance team has been part of the Trust since 2012 and focuses on reducing the harmful impacts of tobacco and alcohol. Their work is vital, as smoking remains the leading cause of health inequalities, and alcohol-related deaths are at an all-time high. Fresh launched in 2005 and Balance in 2009. and they have pioneered regional public health campaigns, achieving significant success. Fresh's efforts have contributed to the largest reduction in adult smoking in the North East over the past 20 years, while Balance's Alcohol is Toxic campaign has raised national awareness. The team also advocates for policy changes, contributing to the Tobacco Vapes Bill Committee and the Health and Care Select Committee on Alcohol. Their mass media campaigns generate millions in media coverage, and their work with local authorities and NHS trusts has advanced tobacco dependency treatment services across our region. We're very proud of their achievements. The team is committed to continuing their impactful work, and with thanks from all of us at CDDFT for our continued support. So big well done to those winners. I'm going to pass over to Frank, our lead governor.
Oh, good evening, everyone. It is my absolute pleasure, on behalf of the Trust Council of Governors, to announce the Governor's Special Commendation recipient. This special acknowledgement is made on the base of the winners of all the categories, recognising an individual or team who truly embodies the values and spirit of our Trust. I've had a very difficult task in selecting just one colleague from this outstanding group of teams and individuals who have gone over and above beyond their respective roles. However, the individual I've selected stood out amongst all the dedication, or for the dedication, professionalism and commitment. So therefore, on behalf of the Council of Governors, I'm delighted to share that Carly Lloyd, Community Palliative Care Team, is winner of the Quality in Care Clinical Award, but also receives the Special Governor's Commendation. And with thanks to Axe House, who have donated 2 hours VIP in recognition of this special commendation. Thank you very much.
So, we've got a bit of feedback there. Just give us a second. So thank you to colleagues. I want to extend my heartfelt congratulations to all of our category winners. After much reflection, I'm delighted to announce that I've selected the endoscopy team and the pharmacy sustainability group for this year's Chairman's Award. Both teams, well done, both teams have demonstrated outstanding commitment to patient care, sustainability, and continuous improvement, embodying our core values. The prize for this award is a VIP Axe House session for 2 hours with refreshments included. My goodness me, you lucky, lucky people. That's going to be quite an event. So congratulations to you. Really, really well done. So proud of the work that you do. So that concludes the award categories for this year. However, the judging panel wished to make some additional special mentions. Please allow me a few minutes to share those with you now. The MRI Trust-wide received many nominations, and the panel recognised the challenges the department has faced with increasing demand. So thank you to you. Maternity services received several nominations across the service. The panel recognised the additional scrutiny and pressure this service has faced, in particular over the last 12 months with the CQC inspections, and were pleased to see so many wonderful mentions of leadership, support, pride and compassion across the service within the nominations received. So congratulations and so much thanks to you. Ward 6 at Bishop received many nominations, and the panel recognised the compassion and dedication of those colleagues. So thank you to you as well. SDEC at both sites received many nominations, and the teamwork and coming together to provide safe, compassionate and joined up care were noted by the panel throughout the nominations. So thank you to you. And finally, the portering team received several nominations. The panel noted that this team that often flies under the radar in terms of recognition, but provides a fantastic and integral service to our patients and our colleagues, and this was evident in the nominations received. So thank you to you as well. In closing, over the coming few weeks, each of the award winners will be featured in the Trust Communication Bulletin and other channels. The full nominations will be included, so we were able to share the pride and the passion which was captured within them. And we would like to thank all of those who took the time to submit a nomination. Thank you to all of you. So that concludes this year's ceremony. So may I thank you for joining us and wish you a really good evening.